Another question I get at meet and greets is how the nitty gritty of how direct primary care really works. On the one hand, they're worried about, hey, is this business model actually viable? Like, if you really charge this amount of money for all access healthcare, how can that possibly work? Are you going to nickel and dime me for every little thing that I get? The answer is no. I'm going to charge you what I charge, or some things are so inexpensive I just throw in them for free with your membership fee. Or that, I mean, if I'm going to join this membership program, I want you to be around for a while. I want to make sure this business is viable. So we run the numbers with how many patients I have and will have and how much they pay, and they can see how it all works out. And also, I get some really nice ones that are worried about my work-life balance and me spending enough time with my family to stay sane as well, which is very wonderful. And so I described that there's kind of three bins of reasons why patients will reach out to me after hours. I mean, bin one is the obviously non-urgent concerns. Will this supplement that I read about online help me grow my hair back? Or hey, I need a medication refill. Those are non-urgent, and those are definitely emails. So I don't check my emails on weekends, evenings. I look at them when I'm in the office, and I respond to them and address them when I'm in the office. So that works out. Then there's bin three. I know we skipped bin two. Bin three is the obvious emergencies. This is when your life, your eyesight, your limb is at risk. So that's when you should not call me. You should go directly to the ER. Crushing left-sided chest pain, a bone sticking out of your skin, blood squirting out of your eyeball. All reasons to go right to the ER. Didn't mean to gross you out. Sorry, maybe that was too much. But bin two is where I really shine. That middle bin where you're not sure if it's an emergency or not. And I don't actually get that many calls about bin two concerns. But when I do, that's when I can really make a difference. That's when my mother of three turned around for just 1 minute, and that third child that's always getting into trouble put their hand back in between the doors just as the automatic van door was closing. And so I can hear in the background, baby's crying, she's crying, everyone is freaking out. And she knows she can call me, and I can talk her through this. And I can say, look, there's no bone sticking out of the skin. Put some ice on it, get some ibuprofen, and just hold her and rock her for a while. And then we'll assess what to do next. Or when it's something like, does this need stitches? That's a really common one too. And I can talk you through, okay, we've got 24 hours-ish to get stitches in here, so it's not an emergency. We can still put this skin back together if we need to, but here are why people stitch things up. Here's why we might not want to stitch this up. Let's discuss the pros and cons. People have been surviving wounds that might need stitches for a long time without getting stitches, but also sometimes it's really nice to have that lack of infection, that faster healing, that not having it open up and bleed every time you wash your hands or whatever it is. So those kinds of bin two concerns actually don't happen that often, but when they happen, it's so wonderful to call up a doctor that you trust that can advise you on what to do.